In this video, we will be reviewing glaucoma by critically thinking through 5 questions. I will read the question for those listening to the video, then pause to give you a second to think of your own answer. Then I'll read the choices and we will discuss. This is just a surface review on glaucoma. If you need more information, you can usually find that under your neurological and/or eye disorder chapters in your nursing resources. We'll also hit some pharmacology in this video. We will discuss beta blockers, miotic eye drops, and the diuretic mannitol. Before we start, I do want you to look at the picture on this first slide. It's a great picture to really understand what's going on in glaucoma, which sometimes I think is missed in this class. If you kind of look in the middle, you can see that the drain of the eye in the back is being blocked. It's narrowed, it's not draining properly. And then if you look at the next picture, we have the eye that has fluid in it because the eye does create fluid, that aqueous humor, and normally that eye should drain normally out the back. So the problem is actually kind of when this drain is blocked or narrowed, and then that creates all the problems we see in glaucoma. Let's get started with the questions. Question number 1. The nurse is screening a client for glaucoma risk. What would be the most important question to ask? Think about what you know about glaucoma risk. Is it, number 1, do you have hypertension or diabetes? Number 2, do you smoke? Number 3, does anyone in your family have glaucoma? Number 4, are you experiencing eye pain? The answer here is number 3. Glaucoma is genetic, and so the best question to ask is about family history. If someone in your family has glaucoma, that means anatomically the eye drain is maybe a little bit smaller, and therefore that's going to be passed on. If you had a hard time with this question, remember it's always a good idea to learn your etiologies and your causes. The difference here in question 1 and 2, those are risk factors. So those are things that would increase the risk of the glaucoma, but not a cause. Genetics is the main cause, making number 3 your best choice. Question number 2. A patient with a history of glaucoma, hypertension, and diabetes comes into the emergency room complaining of severe eye pain. What should the nurse do? Should you, number 1, assess the pain level and quality of the pain? Number 2, notify the doctor? Number 3, check the patient's blood pressure and blood glucose level? Number 4, give the patient pain medication and continue to monitor? The answer here is number 2. You need to notify the doctor. The serious complaint here is the eye pain. Eye pain is a sign of closed angle glaucoma and is a medical emergency. As the eye is filling up with the aqueous humor and it can't drain out the back, it can burst just like a water balloon. So the doctor needs to be notified immediately, and this patient needs to be taken to surgery. If you had a hard time with this question, make sure to review the dangerous signs and symptoms associated with closed angle glaucoma and the interventions. Question number 3. A 65-year-old client with a family history of glaucoma is at a routine eye exam. The patient wants to know which test will screen for glaucoma. Which comment by the nurse is correct? Is it number 1, when the doctor has you read the Snellen chart, that screens for glaucoma? Number 2, when the doctor blows a puff of air at your eye, that shows a tonometry reading, which screens for glaucoma? Number 3, the doctor can tell when your eye is dilated. Number 4, your family history is the best screening for glaucoma, and you will need to go on medication. The answer is number 2. That puff of air that the doctor blows into the eye gets the tonometry reading. And by definition, glaucoma is high pressure. So a reading of greater than 21 indicates glaucoma. Be careful in this question. If you were pulled to number 4, you need to make sure to answer the question. The question asks which test screens for glaucoma, not which question screens for glaucoma. Always pay attention to your questions and make sure you're actually answering what they're asking you. So in addition, it's also a good idea to know the different screenings for eye disorders. In another video, we're going to go over some other eye disorders like vision issues, retinal detachment, and cataracts. So look for that video once you're done with this one. Number 4. A client diagnosed with open-angle glaucoma recently had a tonometry of 24 millimeters mercury pressure. The client is not experiencing any symptoms and is being managed with timolol and miotic eye drops. The nurse is assessing the patient's understanding of eye drops. Which statement, if made by the patient, is correct? Is it number 1, I will know the miotic is working when my pupils dilate? Number 2, when I administer the timolol, the beta blocker, my pulse should slow down? Number 3, I need to push on the inner canthus so the medication does not enter my body and cause systemic side effects? Number 4, I should wipe my eye with a tissue after I apply the eye drops? The answer here is number 3, and the thought is around how to properly give eye drops. They should be spaced out at least 5 minutes apart, dropped into the conjunctival sac. You can blot the eye with a tissue but not wipe it, and the patient needs to be taught to push on the inner canthus for a minute to prevent the medication from entering the body. We only want the medication to work in the eye, not get into the body and cause other side effects. If you had a hard time with this question, make sure to review how to administer eye drops and the medications for glaucoma. We have another video with the medications for glaucoma because there is a lot, and those also will be quickly referenced for you at the end of this video. Number 5. A client is ordered mannitol for glaucoma. Which question is essential for the nurse to ask before starting the medication? Is it number 1, are you allergic to mannitol? Number 2, do you know how mannitol works? Number 3, what is your blood pressure? Or number 4, are you urinating normally? Do you have any kidney issues? The answer to this question is number 4. The most essential thing the nurse needs to know is if the client is urinating and do they have any kidney problems. Since mannitol is removed from by the kidneys, if a client is not urinating or anuric and has kidney issues, the patients can experience some bad side effects like edema, hyponatremia, metabolic acidosis, and even hyperkalemia. If you had a hard time with this question, remember when reviewing your meds to know the most dangerous side effects and the ones the nurses need to be aware of, and the duties, which is our nursing considerations of all the medications that we give. This is a list of glaucoma medications, as well as a few contraindicated in glaucoma. For more information on these, check out our other video that reviews glaucoma medications. Thanks for joining in on this quick review on glaucoma, critical thinking, and learning through questions. Like our channel for more content like this, and find us at signstrategies.com.